Hello everyone, a very good morning to all of you. So today let's talk about cyst. I'll be talking about odontogenetic cyst, non-odontogenetic cyst. I'll not be talking about the in-depth features of all the cyst, but I'll be talking about the basics of cyst and what treatment you do for the cyst. Okay. So what is a cyst? Cyst is basically a fluid-filled cavity. Okay. So I'll try to draw a cyst. Okay. See, it will have what is called as an epithelium. So every cyst should be lined by an epithelium, predominantly stratified squamous epithelium. Okay. What if a cyst does not have an epithelium? It is called as pseudocyst. Okay. So every cyst will be lined by an epithelium. Now, inside the cyst, you will have fluids or gaseous material or semi-fluids. Okay. So inside the cyst, inside the epithelium, I'll have a central part which is fluid, semi-fluid or gaseous material. This is called as the lumen. Okay. A cyst will have an epithelium, a cyst will have the lumen. Okay. Now, it will also have an outer covering which is called as fibrous capsule. Okay. So apart from the central lumen and the epithelium, it will also have an outer structure called fibrous capsule. So this fibrous capsule is nothing but connective tissue. It will show inflammation. Okay. So any cyst will have an outer capsule, epithelium and a central lumen. So lumen will have fluid, semi-fluid or gaseous material. Every cyst should be lined by an epithelium. If it is not lined by an epithelium, it is called pseudocyst, and cyst is not accumulation of pus. So this is very basic and you should understand it. Okay. So now moving on, I'll classify cyst in a very simple way. So one will be odontogenic cyst. Okay. In the odontogenic cyst, the main three types will be dentigerous cyst, radicular cyst, and odontogenic keratocyst. Okay. So the key features, I'll not go in depth. I'll tell you very key features of these cysts. Okay. So dentigerous cyst is associated with unerupted tooth. So it is associated with the crown of the unerupted tooth and it is attached to CEJ. Okay. So dentigerous cyst is associated with unerupted tooth. The crown of the unerupted tooth, it is attached to the CEJ. Radicular cyst is the most common odontogenic cyst. Most common odontogenic cyst. It is associated with the root apex of a non-vital tooth. So it is associated with non-vital root apex. Okay. Odontogenic keratocyst, if you see, it has a high recurrence rate, satellite cells. Okay. High recurrence rate due to satellite cells and also thin parakeratinized epithelium. Okay. Thin parakeratinized epithelium. So these three will form odontogenic cyst. So which is the most common odontogenic cyst? Radicular cyst. Which cyst is associated with non-vital tooth? Radicular cyst. Which cyst is attached to a CEJ? Dentigerous cyst. Which will have more recurrence rate? Odontogenic keratocyst. Okay. So the next cyst classification will be non-odontogenic cyst. Okay. So the non-odontogenic cyst will be nasolabial and nasopalatine. Okay. So nasolabial means there will be, it's a soft tissue cyst. It will not the swelling of the nasolabial fold. Okay. So it is a soft tissue cyst. So there will be swelling of the nasolabial fold. Okay. In the case of nasopalatine, it is the most common non-odontogenic cyst. So most common non-odontogenic cyst and it involves the midline of the anterior maxilla. Okay, so it will be formed on the midline of anterior maxilla. Okay, so this is about non-odontogenic cyst. So non-odontogenic nasolabial nasopalatine, which is the most common non-odontogenic cyst, nasopalatine. Okay, so the next classification will be developmental cyst. So developmental cyst will be dentigerous cyst and odontogenic keratocyst. Okay, the last one will be inflammatory cyst. So in the inflammatory cyst, it will be residual and radicular cyst. Residual and radicular cyst. So what is residual cyst? Radicular cyst is the most common odontogenic cyst. What is residual cyst? Residual cyst means it will be formed after the extraction of a tooth. Okay, after extraction of tooth, it will be present in edentulous site. Okay, it will be present in edentulous site. So this will form the very basics of classification of cyst. So there is something called as lateral periodontal cyst. It will be exactly opposite to the radicular cyst. It will be associated with the roots of vital tooth. Okay, so we have odontogenic, non-odontogenic, developmental, inflammatory. So in the odontogenic, we have what is called as the dentigerous, radicular, or odontogenic keratocyst. Non-odontogenic, nasolabial, nasopalatine. Developmental cyst, dentigerous, OKC. And then inflammatory cyst, if you see, it will be residual and radicular. So without knowing this, you cannot solve any MCQs in cyst topics. Okay, so these are all the basic classification and a few very important points about each cyst. Now the very important is the treatment part. So treatment, I can go for enucleation and marsupialization. Okay, so what do you mean by enucleation? Enucleation is I am removing the cyst along with its fibrous capsule. So here epithelium plus the lumen plus the fibrous capsule. So everything is removed as a whole. I am not touching the normal tissue. Normal tissue is untouched. So I am raising the flap. I am reflecting the gingiva, exposing the cyst, completely enucleating it, and then I am placing bone grafts if needed, and then I am suturing it back. So the entire cyst is removed. I am scooping out the entire cyst. Okay, why it is called enucleation? Removing the nuclear contents. That is why it is called as enucleation. So in enucleation, the entire cyst is removed along with its fibrous capsule. Okay, now what do you mean by marsupialization is, in contrast, I'm not removing the entire cyst. I'm just giving an incision. I'm just breaking the cyst so that the cyst drains by itself. Okay, and what will happen to the fibrous wall? I'm just suturing it to the oral mucosa. So imagine like a balloon. I'm just releasing the upper portion of the balloon and I'm just tying the edges of the incised balloon to the oral cavity and allowing the cyst to drain. Okay, so cyst is allowed to drain and I am suturing the cyst margins to oral mucosa. In what all situations you can do marsupialization? In case if the cyst is very large. Okay, large cyst. 1. 2 is if it is very close to vital structures. 3 is if the area is more prone for fracture, fracture prone areas or regions. So in these areas you can do marsupialization. So this forms the very basics of the cyst treatment, enucleation and marsupialization. With this, the basics of cyst comes to an end. We talked about cyst, what is cyst, what is the contents of cyst, what are the parts of cyst, the classification and a few important points about each cyst and the treatment aspect of cyst. So I hope this video makes sense. Thank you so much for watching the video. Have a nice day.